She's walking away.
She just said that she can't do the IME. The doctor won't be available to 4:30, and my
Yes,
appointment's
2 other
3:30.
patients, and with
And in addition, they say that they can't see me because my hands shake and I'm having trouble with the paperwork. So she just left. She was right here. I don't know where she
maybe
went.
she'll come back and see if he'll take you in
No,
there.
you're not
But-
allowed to record in here like that. No, you're not allowed to do that.
Well, your doctor won't see me. My appointment's at 3:30.
I have to send you home. 'Cause you're
Good.
gonna come up
Let me
and
send
record
you
if you
home.
want.
Terrible people.
Wait, she just said that the doctor won't see me till after 4:30.
She said about an hour because his patient's ahead of you.
Well, I can't. I'm in too much pain.
I know,
I can't
Peter.
wait till
I know you
4:30.
can't sit
My
that long.
appointment is at 3:30.
I know you can't sit that long. I'm sorry.
I'm in too much pain.
Hi, Ashley. I need to speak to Sophia or Anne-Marie, please. I'm sorry. Thank you.
Not any, just us. This is all the paperwork that we're filling out. And the person is refused, saying that we can't be seen. The doctor won't be available to an hour after my scheduled IME.
Yes, this is all.
And I'm in too much pain to fill this out. And I had my friend here and my mother here that drive me, and therefore they're refusing to see me. This girl here, she's the doctor's office. We're not looking at patients. We're just waiting, and they're telling us the doctor won't see me.
Wait until.
And it's almost 4 o'clock, and my exam was scheduled at 3:30. So we're still waiting. That's
He can.
I'm sorry, but once you videotape, we videotape also.
I know. Did you get her
No,
the
no,
desk?
she doesn't want to be videotaped.
No, I'm not shooting her.
Okay.
No, it's not her, it's me.
Okay.
The gal said we can get in the office even though we're at a 30-minute waiting, and doctor will see him in maybe like 5 minutes. Is that about right? No.
It's not a HIPAA violation. I'm not shooting anybody but these two.
No, it's just us. It's in New York State law. You should know what you're doing. It's 1 minute of 4.
My
or
appointment's
4
scheduled
o'clock.
for 3:30.
So it's 30 minutes past the appointment. The young lady said we're able to see the doctor, filled out the information with my help because my son is hard to hold a pen in his hand. It's been 7 years of pain and suffering. He needs a brachial plexus surgery that New York State workers' comp doctors no longer perform. This is all the paperwork here filled out to the best of our ability. And New York Spine and Wellness has all the information over a period of 7 years, which is impossible to fill in right here. So we're doing the best we can, and the young lady said that we can go in
We're
and see the
supposed
doctor
to
in
see
about 5
Dr.
minutes.
Edward Lawrence
Mills
from
Great Neck, Long
Great Neck,
Island.
and he is refusing to see me.
No, he'll see you now. She's saying, and we'll give it a chance to see if this
So-
is correct, if he'll come in 5 minutes and see you.
What I'm saying is that if
Video, we video.
That's that. I get that, sure.
Once
Okay,
you
we're
videotape
on, sir.
it.
Whenever you're ready. Please squeeze by there, Wyatt.
Peter, the young lady's videotaping also.
Okay, well,
You can stay if you want.
where do you want me? Is this okay, Dr. Mills?
Right here. Oh, actually,
Okay, I wanna make
you want to
sure-
sit for now? Why don't you sit? Oh, you don't want to sit?
Oh, no, I can
You don't
sit.
wanna sit.
I can sit right here.
Okay.
You want me to sit here, Dr.
That's
Edward
perfect.
Mills?
That's
I
right.
will sit right here for you.
Okay, you want me to go in the waiting room?
I think you better, because it's 4:12 p.m.
Okay, why don't we close that door and we're ready, right?
Sure.
All right, so I'm Dr. Mills. What's your name?
My name's Peter Robleski.
And I'm an orthopedic surgeon. I've been asked to perform an independent medical examination from an orthopedic surgery standpoint with
Okay.
respect to a work-related injury from May 9th of 2011.
Correct.
This is my first time seeing you.
Correct.
Now, let me ask you some questions. Have you ever had surgery on your neck?
Yes.
How many times have you had surgery?
Once.
Do you remember the date? Well, let me ask you. this.
2000, I think it was 14, 15.
It was the result of this injury, May 9, 2011.
Yeah. We tried, he wasn't a brachial plexus surgeon.
Hold on a second. So you've had surgery on the neck, though, right?
Yes.
One
Well,
time.
the doctor, yeah, the neck going down on the left side, but he wasn't a brachial plexus surgeon.
Now, is that the only surgery
Yes.
you had on your neck?
Yes,
Is that the only surgery you've had as a result of this case?
correct.
Is anyone recommending any more surgery
Yes.
on your,
Brachial plexus compression, a brachial
is that
plexus.
scheduled?
Neuro-
Is that something
No, his name is Dr. A. Lee Dellin of the Dellin Institute.
Okay,
He examined me and he looked at the MRIs. He said, this is radiographic evidence of a brachial plexus compression.
fine.
He said, that's the radiologist report. Your symptoms, the trembling in your hands, the numbness in fingers, you live with the pain or you have brachial plexus surgery, which was different than what because the other doctor was like, no offense, like an orthopedic doctor.
Right.
And I guess the brachial plexus is more complicated.
Are you working?
No,
Are you doing physical therapy at this time?
no,
Have you had any injections from this?
they've tried many injections.
Anything recent?
Nothing recent.
Any broken bones you're aware of from this case?
No,
And what happened on 5/9/11?
I was sent over to do a safety course.
Mm-hmm.
The instructor used me to demonstrate a procedure, and I was a CPS worker, and they put us in some rough situations, especially when you have to take kids.
Mm-hmm.
So the instructor struck me, and I didn't know he was going to hit me, and he hit me so hard, he hit me in my neck. Bam!
All right.
And after that, my neck hurt, but I thought, well, it'll just heal. And then it obviously didn't heal, and it took me a long time to figure out what was wrong with me because all the doctors kept saying your muscles are extremely tense. It's spasming. They said I have spasming going down to the shoulders. And then they tried every injection they tried Botox, cortisone injections,
Okay.
pain injections. Nothing worked. And right now the only treatment is muscle relaxers and pain medication. And that's what they're treating you. They're unfortunately the only doctors that perform brachial plexus surgery that accept workers' comp in New York State are zero. I had an appointment, Dr. Lawrence, with Dr. Winfrey. Are you familiar with him?
No.
Christopher Winfrey? Well, I think he's near Great Neck, New York, or he's in your area. And 2 weeks before my appointment, he canceled it because he said I stopped participating with workers' comp. He's a brachial plexus neurosurgeon. So that happened.
But the
So
plan is to still proceed with the brachial plexus surgery.
either that or be on increasing medication, which is putting stress on my
Let me
blood
examine.
pressure, my heart.
Where's the surgery from the neck? Where's the scarring? They went through the back?
No, it's right here on the left side. Can you see that?
Yes. All right, just face straight ahead now. And I'm going to examine you. Only what you can do on exam without harming anything, okay?
Okay, well, hold on. Here, I don't want you to.
Well, yeah, we'll just...
Can you just pull this off wide for me? Pull it off. Thank you.
All right, now just face straight ahead.
Feel that. Feel the
Okay,
feel the
Just
tremors.
let me do the examination.
Fine.
okay? If you don't mind, just face straight ahead.
I am okay.
Okay, now, can you lean the neck forward
Yes,
and backwards?
it's harder.
Can't do it?
No, like as soon as I try to pull back,
Just face
It's
straight
painful.
ahead. Can you lean the neck, face straight ahead, please, with your feet. There you go. Can you lean the neck tilting to your right and to your left?
ow, Jesus. Oh no, it hurts when I move my neck.
Can you turn your head and look to your right,
No,
to the left? Does it hurt when you move the neck for me?
yes,
I'm going to feel back here.
go right ahead.
Any pain? No?
Right there,
There?
here, yes, and that's it too.
So on the sides there?
And into my shoulder blades. You can see Just if you pull it, just look at my shirt. Look at the shoulder. You'll see the muscles. They're spasming uncontrollably.
All right, can you face me now?
Pain right here, and you can feel it right there.
Okay.
Just straight down.
Just face me now, please. All right, can you bring the arms out? Can you bring the arms up? Stay still, don't move. Stay still, don't move. Spread the fingers. Keep them spread. Squeeze, make a fist. Open up. Do you feeling? You feel me touching?
Yeah. There's numbness in my fingers, like
Both
frostbite.
hands?
Yes.
All right, you can have a seat.
And you're not a brachial plexus surgeon, correct? Correct?
I would not consider myself a brachial plexus surgeon, correct?
So Dr. Dellin is.
All right, so
All right.
my understanding is, if I'm hearing you correctly, you intend on proceeding with brachial plexus surgery. Is that
Yes,
correct?
but I don't have $70,000, so right now it's on hold.
Okay, but, forget about payment. If that wasn't an issue, would
I
you
would have it.
proceed with the brachial plexus
Yes,
surgery?
I've tried just about every treatment, pain related, everything with the pain management, and if there was any new treatment that I hadn't tried, I would try it. But over the years, I've tried everything, and nothing's helped. And it wasn't until 2013 I paid for the MRNs. I paid for them out of my own. I sold my car. It was $10,000. So I spent that money, and the MRN said bilateral compression of the C6, C7, and then it said compression of the brachial plexus nerves and on both sides.
All right, I understand.
And Dr. Dellin said, he examined me and he said, Peter, I'm a brachial plexus neurosurgeon. I teach other surgeons how to do this. You live with the pain or you have surgery. I wanted surgery, but Dr. Dellin is, he didn't comply with New York State's workers' compensation costs. So
It's okay.
nothing
I got it.
happens.
That's
And
it.
you seem like a nice guy, but you aren't.
All right. That's it for the examination. I will send the report out for you, okay?
There's another neuro. I have an appointment with Dr. Nader Paradian. You can call him Dr. Nasser Paradian, UCLA. He has an appointment to see me because he reviewed the images, and he says he wants to see me for a brachial plexus surgery. So I'm going out there April 25th to have him examine me, because no one in New York State will, because no one in New York State, other than Christopher Winfrey, who no longer accepts workers' comp, can examine me.
All right. I don't know about that.
Well, look at Dr. Filler's report. Look at the MRI from 2013. It says compression of brachial plexus.
All right. I understand. I can't discuss anything, but I will send a report out for you, okay?
Well, they are not going to pay, so,
All right. You have a good day. Thank you.
Let's go.